This is Mount Kilimanjaro, Africa's tallest mountain, rising 5,895 meters into the sky, a place of breathtaking beauty, but also of silent danger. Each year, between 30,000 and 50,000 climbers set foot on this mountain, yet almost 3 out of 10 climbers lose their lives here every year and never make it to the summit. The dream ends before the peak, not to avalanches or rockfalls, but to the thin air itself. Oxygen levels drop to less than half of what we breathe at sea level, with nausea, pounding headaches, and in severe cases, fluid filling the lungs or swelling the brain.
Most Kilimanjaro evacuations start the same way, a mild headache that someone ignored. Don't be that story. Hi, I'm Dr. Dave. I'm an ICU doctor, and I just climbed and summited Kilimanjaro with my dad and my brother last month, and I did it without any training. In this video, I'll give you the complete medical considerations you need to take before starting the climb. These are exactly what I told my family, my dad, as we were climbing Kilimanjaro together. By the end of the video, you will have confidence in your ability to recognize symptoms in acute mountain illness and have a robust plan to avoid any complications ever happening to you. This is a practical doctor-to-climber advice and guidance that you can start using immediately. It's educational though, and it's not a substitute for seeing your own doctor. I'll cover an altitude plan, medications and kits that you need to take, red flags that you need to watch out for, infections and vaccines, and other essentials when you're climbing the mountain like the cold, UV, feet, etc. And the chapter links are below if you want to just skip to it. So let's start with the altitude plan. To summit 5,895 meters safely, your itinerary matters more than your VO2 max. Choose a 7 to 9 day course. You can go shorter if you're experienced, but at least if you're a beginner, do that. Shorter itineraries increase the risk of AMS, high altitude pulmonary edema, and high altitude cerebral edema, HAPE and HACE. These can happen even in the fittest people if you don't follow the right plan. Climbing Mount Everest, which has less daily elevation gain than Kilimanjaro, 2 military guys in my group that we were climbing together, they were probably the fittest in the group. They couldn't even reach the Everest base camp, and they had to descend because they did not follow simple rules to avoid acute mountain illness. And this was despite me telling them. One of the guy kept hiking when a mild headache turned into him vomiting blood, and he was not telling anyone, and he had to be choppered down. So these are things that you need to be mindful of, and these exact steps in your plan will help you prevent anything like this from happening. But quickly, before you go on this trip, you need to have a pre-screen appointment with your doctor. Discuss the climb, especially if you have cardiac, pulmonary, neurologic disease, if you have sickle cell disease, if you're thinking you might be pregnant, you have severe anemia that needs to be fixed, or sleep apnea. And if you do have sleep apnea, bring spare CPAP parts and batteries, and make sure you consult your doctor about going to the altitude. If you got asthma or COPD, make sure you get action plans in writing so that you know what to bring, what puffers, what medications to bring with you. So to cover the main concepts of the plan that I want you to remember, number 1 is climb high, but sleep low, wherever the route will allow you to do so. Especially if you go above 3,000 meters in altitude, you want to minimize the sleep altitude gains to less than 500 meters a day. Why? Because when you elevate more than 500 meters per day, this increases your risk of acute mountain sickness a lot. A lot of the Everest base camp tours, treks, you're not elevating more than 500 meters for your sleep elevation, meaning the elevation you sleep at one day and the elevation that you sleep at the next day. If it's more than 500 meters, the risk of AMS increases drastically, which is why you should select a longer route. 7 to 9 days is probably ideal. The other thing to remember is you should take frequent rest stops during the hike. So now the day hike might be 4 days or 4 hours or 14 hours. It doesn't matter, but make sure you're taking frequent breaks to eat and drink at least once every 1.5 hours. Bring lots of snacks that are high in carbs, high in fats, and some protein bars will also be helpful. But you want, again, carbohydrate focus and fat focus, because that's going to be a longer term energy fuel source for you guys. And the more rest you need, it's fine, especially in the beginning of the treks. But just remember, for summit hike, you don't want to be taking a lot of breaks. Minimize the stops as much as you can. It gets cold. You want to keep some momentum. And as your body starts to cool down, it's going to be harder to reinitiate hiking again every single time. So minimize that, especially for the summit push. The other thing to remember is to hydrate to the point that your urine is pale yellow or clear. And so I want you to be looking at your urine every single day, every single time you urinate, and see what color it is. If it's getting dark yellow or golden, you're in trouble and you need to drink lots of fluid because you're dehydrated. And I'd recommend drinking at least 4 to 5 liters per day minimum. And if you're male or a bigger person, drink more. And then the other thing to remember is that every single meal you want to eat lots of high carb meals. Now, climbing a mountain is not the place to lose weight. So your focus should not be to minimize carb intake. You should maximize carb intake. As many noodles, sandwiches, bread, eggs that you can get in, eat them. Another important point, and this will vary based on which tour guide or tour group you go to, is the measurement of oxygen saturation, your SpO2. You can get a very simple O2 monitor that you can buy yourself off Amazon for like 30, 40 bucks. So either bring it yourself or make sure the group you're going with has it, but this should be checked at least once a day. The sats should be at least 80%, and they should be 90% for the first few days of the hike. And as you go into higher altitude, it's normal to have a lower oxygen saturation into the 80s. That's okay. But if you're the day before summit, you're Karanga or Barafu camp and your sats are in the 60s or lower, you need to stop. Do not ascend. Take some rest. I heard a story from one of the guides about someone who had an oxygen saturation of 30%, but they looked fine and they pushed them to the summit. Thankfully, they did okay. But that is very risky. Why? Because at lower oxygen saturations, your brain and organs are not getting the nutrients they need, the oxygen they need to sustain themselves, and you will suffer brain injury, cell death. So you can have brain damage that might not be detectable during the hike up and down, but it may develop over the next several months or even a year. And there's some studies that show you can have persistent brain injury that manifests itself over time. So just be careful. Don't risk your life and long-term outcomes for the short ego and status boost. You can always climb again when you're more prepared. So if your sats are lower than 60, I would advise you to pause, take a rest for 24 hours, measure again, and see if the sats have improved, and then go from there. Most of the time when you acclimatize, your oxygen sats come up and then you can ascend safely. Another thing to remember, no alcohol or sedatives like benzodiazepines or any other antipsychotic medications. They can serve as a ways to blunt your breathing drive. And your breathing drive is extremely important when you're going into high altitude. So I would definitely avoid alcohol during the whole trek, especially before starting and then during the hike as well. I saw some of the local guides drinking. I mean, they're experienced and they've done this quite a while and they've acclimatized their bodies to this, but I would not recommend for you as a climber to do that. Lastly, one common question I got about the hike was coffee. Like, is it safe to drink coffee? I mean, I love coffee. I drink coffee every day. I drank it basically all of the days of the hike in the morning at breakfast, just 1 cup. Don't drink it in the afternoons, obviously, because it'll affect your ability to get good quality sleep at night, which will then increase your risk of AMS. But coffee in the morning is fine. Latest maybe 1 p.m., but not after that. And then for the summit push, I did not drink any coffee at night. I know some people did because they want to stay awake for the night hike. That was their choice. But I would personally recommend avoiding caffeine because caffeine has been known to cause vasoconstriction in the cerebral blood vessels, meaning you actually have less blood supply to the brain when you have acute caffeine intake. You combine that with dehydration with high altitude, it will increase your chances of AMS. So I would just avoid that for one day. You won't get any withdrawal headaches because then by the time you come back down in 12, 14 hours, you can have caffeine then, which is exactly what I did. So ultimately for your plan, the golden rule to remember is if you develop altitude symptoms, stop ascending. Rest for 24 hours. And if you're not clearly improving or you're worsening, you need to descend ASAP. People get into trouble and have to get chopper down when they push through, when they have these signs in front of them and they ignore them. So don't be that person. So what medications do you need and what goes in your kit? So first of all, obviously talk to your doctor ahead of time so you can make a plan beforehand, especially if you have other medical conditions. But here's the standard approach I will give for all climbers. One is Diamox. I would highly recommend taking Diamox for Kilimanjaro for both prevention and treatment of mild AMS. And the reason I recommend this for Kilimanjaro and not for Everest Base Camp, I took it for Kilimanjaro but not for Base Camp, is because of the significant increase in daily altitude. In Kilimanjaro, you have significant altitude gain per day compared to Everest Base Camp, which is a 14-day hike versus the 8-day hike that we did in Kilimanjaro. And that increased your risk of AMS. So the acetazolamide will actually reduce, there's good studies and good evidence that it reduces your risk of developing AMS in this context. So the dose you should be taking is 125 milligrams twice daily. Start the day before the ascent. So if you arrive in Moshi, day 1 and then day 2, you're starting the hike, which is what my La Mosha route itinerary was, then start it the day before and take it twice a day, once in the morning, once at night, and make sure it's the same time every single day or as close as possible. And then you want to keep taking it every day while you're ascending, and then at least another 24 hours while you're at peak high point, and then you can stop taking it when you start descending. So after you've done the summit push, you're coming back down. Later that night when you get to your camp in Hueca, you can stop taking Diamox at that time. Some of the common side effects, which I got asked about quite a bit, is very common. You'll get tingling in your fingers and your toes. And weirdly enough, for me, the tingling happened mostly at nighttime, not during the daytime. Maybe one day I remember having it during the daytime at breakfast, but most of the time it was like at night when I was really cold. So a way to prevent that or to minimize that would be to make sure you have lots of hand and feet warmers. Keep your hand and feet warm. It will help minimize this. But tingling is normal. If you have numbness, which means you can't feel things, or if your hand starts to get a bit heavy or you're losing power in your hands, those are neurological symptoms, and that's not from the Diamox. It could be something else like acute mountain illness or stroke or something like that. So that needs more attention. But if it's just tingling, a little bit like vibrations in your fingers and toes, I had that majority of the days, it's normal. The other thing you'll experience also is a lot more peeing because Diamox is a diuretic, and I can go into the physiology of that in another video. I don't want to cover that here, but essentially you will be peeing a lot more, and that's okay. That's actually good because your body's kind of balancing it, and you're going to be drinking 4 or 5 liters every day. So you will be peeing a lot. An issue was that a lot of a lot of climbers wake up at night to pee, and I had this issue too a few of the nights. So the way I address that would be I drink lots of water during the day. My last drink would be like an hour and a half before bedtime, and then maybe just 1 sip at bedtime just so I'm not like dehydrated, like orally. But yeah, maybe an hour before bedtime could be your last like drink. So then you can go pee, get yourself emptied, and then you should be good for the rest of the night. Another thing for Diamox is that you should avoid that in pregnancy and then see if you have a sulfa allergy, because sometimes there can be cross-reactivity. It's rare, but definitely something to review with your doctor. However, if you can't take acetazolamide, another thing you could take is dexamethasone, which is a steroid as backup prophylaxis. I wouldn't recommend this for everyone, so definitely talk to your doctor because the steroids can be pretty intense and they have some severe side effects compared to Diamox. But the dosing you take for dexamethasone would be 2 milligrams every 6 hours or 4 milligrams every 12 hours while you're ascending. And if you get severe acute mountain sickness or cerebral edema, dexamethasone is actually the treatment of choice for that. And usually the treatment is 8 milligrams once and then 4 milligrams every 6 hours. And obviously descending is the solution. So another thing to keep an eye out on is high altitude pulmonary edema. The plan for this, obviously, if I'll discuss the symptoms in the next few minutes, but if you got HAPE, you need to descend ASAP, and typically the treatment for that is nifedipine, which is a calcium channel blocker. But again, this is doctor mediated. Some of the other things you should have in your kit that will be helpful is ibuprofen, 600 milligrams. You can take it 3 times a day. It can reduce your risk for AMS, but watch out for stomach and kidney issues. Ondansetron or other antiemetics for nausea. Oral rehydration solutions, have lots and lots of them to make sure that you're hydrated well. Loperamide for non-bloody diarrhea. Albuterol, which is a puffer for if you're asthmatic or a history of COPD or a smoker. And then make sure you bring a pulse oximeter, whether with your team or yourself. But remember, it's not always the number. You have to treat the patient or the person as well, not just the number itself. So what are some red flags and how do you identify these conditions? If you're on the mountain, how would you know that this is acute mountain sickness and not just like a mild headache from hiking all day? So there's a few key symptoms you should be monitoring. Acute mountain sickness, some of the symptoms you'll get again are headaches, nausea, and if nausea proceeds to vomiting, that's a huge red flag and you need to be descending right away, especially if you're vomiting. Headache and nausea, mild symptoms of that is okay and tolerable, but if they continue to get worse as you ascend, that's something to note. Dizziness, severe extreme fatigue is a big one. Poor sleep, and another like a really sneaky symptom is poor appetite. As you're ascending and you're getting less and less hungry, that's a bad sign. That could be signs of acute mountain sickness. So make sure you're able to still eat. My dad kind of had this the night before the summit, but he still felt overall good. So I said, okay, keep going, don't eat. And he didn't have a bowel movement for 2 days. So like that was his reason for low appetite. So again, there's nuances to that you obviously need to discuss with the team. This is why it's good to go with a good group and a good guide. If you have acute mountain sickness, the treatment is, to descend, stop ascending. If it's just mild, you could rest for 24 hours and then try again to see if the symptoms improve. Have some carbs, drink some fluids, take the acetazolamide. And then if it's not improving, then you need to go down. If it improves in 24 hours, you could always try to descend just a little bit, maybe just 500 meters or 1,000 meters and see how it goes. If you have HAPE, which is high altitude pulmonary edema, symptoms will be breathlessness, cough. Sometimes you'll have like coffee sputum come out, crackles in the lungs, and a low SpO2, low oxygen saturation that's out of proportion with the altitude. So the treatment here is immediate descent and oxygen if the guide has it available, and then ultimately you might need hyperbaric treatment as well. For cerebral edema, high altitude cerebral edema, the things you'll want to keep an eye out for is ataxia, which is the patient can't walk in a straight line and they have coordination problems. Like if you were to lift coffee cup and drink, they would miss the cup or the cup would be shaky. That's ataxia. That's really concerning. That's very severe. If you have confusion or a severe headache, or if the climber's behaviors alter, their personalities change in any way, those could all be signs for cerebral edema. This is an emergency. You need to descend ASAP, maybe even call a chopper based based on how severe the symptoms are. Treatments are otherwise oxygen and high dose steroids. Ultimately, go with an operator that carries oxygen, has their guides that are properly trained in all of this and how to identify and create a plan for you. And then make sure you have a clear plan on when to stop, what signs to look out for, when to medicate, and when to descend. Don't negotiate when you're hypoxic and you have these symptoms. And you shouldn't be making this plan on the fly. You should have this discussed with your team beforehand. Some other things, to note is Kilimanjaro is very high and cold, but the approach cities like Moshi and Arusha, they're not. Make sure you have some malaria prophylaxis taken before the climb. Use bed nets as needed. Make sure you're up to date with your routine vaccines. And then for food and water, make sure you boil and filter the water and bring lots of water for your purification tablets. For us, this was lifesaver. Avoid raw foods and meat, and then carry azithromycin as well for severe traveler's diarrhea, as well as the rehydration solutions. Bring lots of them. For the cold and the wind at night, you will be pretty chilly, especially at the summit. Make sure you have lots of different layers. Use the wicking base that wicks out all the moisture and your sweat. Warm mid layer, and then insulated puffy outer shell. And then make sure you have something to cover your head, which I covered in another video that I didn't. Insulated gloves, insulated water bottles is key, and then make sure you bring lots of hand and feet warmers. The ultraviolet light at high altitude is actually very brutal, so make sure you bring category 4 glacier glasses, SPF 50 plus minimum, and an SPF lip balm, and then just make sure you're reapplying pretty frequently. All these little things can make your experience much worse and worsen potential complications. Other tips: break in your boots beforehand so that you're not doing it on the mountain. Have socks that are moisture wicking. Make sure you pre-tape some of the hot spots, and then carry hydrocolloid dressings if you end up having some blisters. Keep your nails trimmed on the feet. This is a key big one. And then bring lots of foot warmers. My feet were cold every single night, and I had to put like little heat packs in my feet to be able to fall asleep. So that was actually a big issue. So make sure you bring lots of heat warmers or even just heat packs. Trekking poles are really helpful. My dad used them. I use them on a couple days. For long descents especially are really helpful and will save your knees. Learn the proper technique obviously. For fitness planning, obviously I didn't do any preparation, but I would recommend, if I were to do it again, I would definitely prepare much better because it would be less suffering. But ultimately prepare at least 8 to 12 weeks out, 2 to 3 months. Do lots of uphill hikes, with a pack to figure that out. Do step ups and lunges multiple times a week. And then one thing I highly recommend, which I did a couple times before, was like Stairmasters. But yeah, just go hard on that. Lastly, if you've got anemia or if you've got some iron deficiency, I would definitely make sure you address that before you go, because it directly affects your oxygen carrying capacity. When you're at high altitudes, there's low oxygen availability. If you can't carry that oxygen around the body effectively, then you're going to be in trouble. So ultimately, to recap, we've covered a smart altitude plan with exactly when to start, when to stop, how to monitor your symptoms, medications you might need in advance, how to identify these red flags while you're on the mountain, and then other general things like infection, water, cold, stuff that you want to make sure it's all dialed in. So if you just remember one thing from the whole video, is that never ascend with unresolved symptoms. If you have altitude symptoms, stop, treat, or descend if they're not getting better. That mindset will get you up and back down safely. I hope this helped. If it did, hit like and subscribe, share with your climbing group, and drop any questions you might have. I'll read every comment and I'll answer as best as I can. Safe climbing, and I'll see you on the mountain.